Slayer Center in Moline. You must have a confirmed time slot to receive your vaccination at this clinic or any of our clinics. People will be asked to wait in their cars at the Tax Slayer Center parking lot and tune their radio to 89.7 FM and to be told when people in their time slot will be allowed to enter the building. Only about 50 people will be allowed into the building at the same time as to adhere to the Restore Illinois guidelines. Social distancing and masking will also be enforced. We prefer to use our usual site, which is the Greater Quad City Auto Auction, because it is efficient and it prevents people from gathering indoors during the pandemic. We vaccinated more than 800 people last week in 5 hours. We will be at the auto auction as often as the weather allows, and we will announce this through our media partners on our social media and our website whenever weather forces us to relocate to the backup building, which is the Tax Slayer Center. We appreciate the willingness of all the leaders of the Tax Slayer Center, the City of Moline, and the Greater Quad City Auto Auction in helping us find suitable sites to complete this historic public health vaccination effort. We will continue with our online registration system for time slots for our vaccination clinics. A link to register for the first dose time slot will go live tomorrow on Friday at 10 a.m. and on our Facebook page and at richd.org. We will have 350 first dose slots available. A second link for those needing their second dose will go live at 11 a.m. in those same places. Only people that have received their first dose on January 12th or before will be eligible to receive the second dose. We are giving Moderna vaccines at this clinic. We are using Sign Up Genius for the slots. You do not need to sign up for a Sign Up Genius account. For first dose, just click a slot and put your name and email address and then click submit. It's very important to click submit or it doesn't get saved. For second doses, you still don't need to sign up for an account, but you will be asked 2 questions that will require you to say when you received your first dose and what brand of vaccine it was. Then you will need to put in your name and email and also click submit. We set out a plan for first and second doses earlier this week. We recognize that there is a potential bottleneck for the second doses toward the middle of March if other partners do not have supply to give second doses. Next Tuesday's plan will stay the same, so the 350 first dose slots and 450 second dose slots. Beyond next Tuesday, we are looking at ways to prioritize those second doses, knowing that other partners can offer the second dose as well. The plan we announced earlier this week will need to be changed because our vaccine allocation is no longer predictable. We are also no longer, we can predict which vaccine manufacturer supply we will be sent. We will announce any changes as necessary to our media partners on our social media page and on our website. As we've said throughout this pandemic, we are in a quickly evolving situation. We are balancing the first and second doses with the small amount of vaccine coming into our county. We are working with the numbers and trying to remain flexible so that we don't have to cancel a clinic due to the low supply. To help with that second dose bottleneck, we are happy to announce today that at Illinois Quad City Hy-Vee pharmacies, they are able to give second doses to people no matter where they received their first dose. We also got word today that the Illinois Department of Public Health that we can send 975 doses of Pfizer to both Unity Point Trinity and Genesis Health Systems to start vaccinating their patients. Our total allocation from the state for next week is 2,450 doses, and the direct shipment of Pfizer, 1,950, that's 975 to each of those 2 hospital systems. So the total allocation is an increase of 850 doses over the last week. We also share doses with community healthcare, which is vaccinating groups in phase 1B on the weekends. As we just said, we are relying on our partners to help us vaccinate everyone 16 and older in Rock Island County. Here is a roundup of the ways to get the vaccine now, but remember that next week, only 2,450 doses are coming into the county, and 1,950 of those are going to the health systems to begin vaccinating their established patients. Rock Island County Health Department, our link will go live at 10 a.m. every Friday for the first dose, and a second link at 11 a.m. for the second dose on our Facebook page and on our website at richd.org. Hy-Vee also has an online registration at hyvee.com, walgreens.com. Jewel Osco Pharmacies is albertsons.com. And community healthcare can be located at www.chcqca.org. We are using an internet-based registration system to make this mass vaccination effort work as well as possible. We do understand that older residents might not have access to computers or the internet. Today, we are announcing a partnership with Alternatives for the Older Adults so that older adults 65 and older can make a call into a resource center and get on a list for an available slot. After most Rock Island County older adults have been fully vaccinated, Alternatives will join with the Quad City Open Network to help people younger than 65 who do not have access to a computer or the internet to sign up for a vaccination. Here with us now is Kathy Wyman, the Chief Executive Officer at Alternatives for the Older Adult. Thank you, Kathy.
Thank you, Nita. So yes, we're rolling out some extra lines and extra phone numbers. As you can guess, we're anticipating quite a few phone calls. And so we are looking at February 15th to begin taking calls from 9 a.m. to 3 p.m. at the Alternatives Vaccine Support Center. And we're happy to partner with the Rock Island County Health Department. And we're hoping to partner with all of the vaccine providers to see if we can get some slots for the folks that we'll be taking calls for. So we'll take names, we'll answer some questions, we'll get the information we need and the callback number. And as soon as we can get each person into a vaccine appointment, we'll call them back to let them know when it is and where to go to get it. So that's our process. We have a toll-free number that's being expedited on our behalf to make this happen. And we do have all of the human service agencies in the Quad Cities area are able to, through the Quad Cities Open Network, communicate with each other, making referrals through a coordinated system. And so that also allows us to get names and information about individuals that may interface with a different organization. So we're excited to work with the Rock Island County Health Department and all of the partner agencies. Again, to start on February 15th, we will start taking calls from 9 a.m. to 3 p.m. You may get voicemail, so if you leave a message, we will call you back. And we may not get you registered, but we will get you on a list. So please be patient, and we welcome all the calls. It's certainly part of our mission to support the wisest of our communities, the older adult.
Thank you so much, Kathy, for sharing that new partnership. I know that'll be very beneficial for Rock Island County. We do have just a brief update from Ed with Scott County Health Department, so we'll go to that and then we'll ask for any questions in our chat.
Well, we have some good news today. There's a conference call today with the Iowa Department of Public Health in which it was shared that we, Scott County, will be allocated a stable supply of vaccine for several weeks. This is something we have not been guaranteed in the first 8 weeks of the vaccine rollout. This information.
Ed, I think you're still muted there. Can you unmute yourself?
Okay, well, let me go back and to the top then, I guess. Hold on. Okay. We've got some good news today. There's a conference call earlier with the Iowa Department of Public Health in which it was shared that we will be allocated a stable supply of vaccine for several weeks. This is something we have not been guaranteed in the first 8 weeks of this vaccine rollout. This information and what we learn on tomorrow's call will allow us to update our plans and provide some continuity in vaccine availability for the residents of our community. The bad news was that our supply is not increasing. It will remain low. But knowing our upcoming allocations, we're better able to plan for the upcoming weeks. Vaccines will be given to priority groups in phase 1B, tier 1, as well as the 65 and older priority group. The announcement of a stable vaccine supply also allows us to allocate vaccine to our healthcare partners who are best able to immunize people in that 65 and older priority group who have the highest need. We believe the upcoming weeks will ensure a more stable supply and bring a better method in getting the vaccine to that 65 and older population. We'll share more information next week. Another welcome development in Iowa is the direct allocation of vaccine to retail pharmacies. Vaccine is or will be available in limited amounts at local pharmacies, including Walgreens and Hy-Vee. Now, we don't want to raise expectations too high. The vaccine supply still remains low, and the supply these pharmacies have is very limited. But please note, the Scott County Health Department does not schedule appointments for pharmacy clinics. Please contact these local pharmacies if you have questions about appointment slots or registering. Iowa does not require a vaccination code that you need to enter into either system.
Thank you, Ed and Kathy and Nita. We have received a couple of questions in the chat, but we have a couple that we received ahead of time. And these will mostly at this time be for Nita and Ed, if you guys can jump back on. First question is for Nita, and there's actually two, so I'll have you kind of address them together if you don't mind. Questions about individuals signing up for that second dose. So for example, a person who got their shot on January 12th and is eligible for February 9th second dose, should they sign up on Friday, February 5th?
Yes, that is the plan. That link will go live tomorrow on our website and on our Facebook page. And if you received your first dose on January 12th, and just to reiterate, that was a clinic for healthcare workers that we did. And we had about 320 people come through. So that first clinic was nowhere near 1,000, and we have set aside 350 slots for second doses for the February 9th clinic for that.
And then I think the second question related was, would you just like to discuss further how you're following recommendations about the time frame between the first and second dose?
Sure. So the recommendations from the CDC, from the manufacturer, it's at least 21 days after your first injection for Pfizer and 28 days after your injection if it was Moderna. However, the CDC has extended that to 42 days from the first vaccination for either of those. And beyond that, they actually say that if you cannot get it at 42 days, just get it as soon after that as you can. We do realize, that there are a lot of people from our second clinic that will need the second doses on the week of February 16th. And that's why we're going to be tweaking our system a little bit moving forward after next week.
Thank you. Question for both of you, and Ed, we can have you discuss this first. And in light of the weather we currently have, when bad weather kicks up this season, what advice do you have for vaccine administrators and people with appointments? Should one party always be responsible for contacting the other about postponements or cancellations? Ed, what would you say on our side of the river?
Well, we can't speak for all those in Scott County who are scheduling and providing vaccinations, but for clinics hosted by the Scott County Health Department, we'll contact those people who are scheduled and provide them with any weather-related changes or rescheduling instructions. Should a clinic still be held in poor weather and a person is unable to make their scheduled appointment, we do ask that person to contact the agency who is providing the vaccination. Our vaccine supply is very scarce and every dose counts. In the case of the Scott County Health Department clinic, we will want to make sure we can contact the next person on our built-in standby list to come get that dose so it does not go to waste.
Nita, do you have anything to add for how you're handling things on the other side?
Sure. So we did have that happen last Tuesday, as you know, and we would put out the same information as we did before, which is to share it with all our media partners and put it on our social media pages. We did have it on the television station news crawlers, and that is the best way to go ahead and let people know that we're not going to be able to host the clinic. We did save those spots for the people that were registered for last week. They did get them this Tuesday, and we would certainly do that again. However, having the tax slayer now as our backup location, we are hoping not to have to postpone or cancel anymore.
Thank you. I don't see any additional questions at this time, so we'll go ahead and conclude for today. Please, everyone, be safe with the weather. We'll be posting our information on the site as well as on our Facebook pages where you can continue to get additional information from us. But everyone have a safe and good afternoon. Thank you again.